So my name is Ian Bishop. I'm currently a medical student at the University of Miami. I decided to actually take time off during my pursuit of a medical degree and pursue a master's in public health, largely because of this city and the opportunities that it provided to kind of put you at that nexus of public health and clinical medicine. My background was actually political science. I studied comparative politics as an undergrad. I was really interested in healthcare systems in resource-poor settings in the developing world. And that kind of led me abroad. I spent a lot of time in East Africa working on projects focused on maternal child health. I've spent time down in Haiti working on cervical cancer screening programs. So all of those opportunities led me to medical school, largely because of the diverse population down here, the opportunities to make an impact even as a medical student. I'd have to say easily my favorite course here was a course entitled Community-Based Participatory Research with Dr. Aaron Kobetz. The concept behind the course was that in epidemiology in the field, we often take the biomedical approach, a top-down approach to conducting research. As someone associated with an academic university, you go into a community, you collect whatever data you're looking for, and you leave the community. Unfortunately, that community that you worked with to gather this data often never benefits from this data. They often never even see this data. So the concept behind the course is that you turn that upside down. You actually go into the community, and your first step is talking with the community, seeing what their concerns are, seeing what their needs are, and working with them to build sustainable resources and interventions that will last the test of time. That way your mark is left there, the community benefits, and even when you leave that community, the benefits will remain. I think my most memorable experience was actually being in the field and experiencing a lot of the diversity that Miami has to offer. Anyone can take a master's in public health course, sit in a classroom and study textbooks. But the real difference here is that you study in the classroom and then you have a number of opportunities outside the classroom. There are a number of communities here that are in need. So you take what you learn and you actually get to apply it to the field. You get to work with community members. You get to work with community leaders. One of the opportunities I've had is to spend a number of time in Little Haiti, which is the largest Haitian enclave in the United States. We studied what it means to do field work. We studied some of the principles. We studied some of the resources you can leverage, and then we went to the field and we used those. And that's really, I think, what separates the University of Miami from other schools. So my capstone project focused on working with the Haitian community, both in Little Haiti and Haiti, the country. What we attempted to do was better understand why there's such a high prevalence of cervical cancer among Haitian women. Haitian women experience almost 3 times the incidence of cervical cancer than other communities. So what we did was we worked with community healthcare workers, lay women from the field who knew these communities, who knew these women, and we tried to understand some of the barriers to regular Pap screening. The easiest way to identify early cervical neoplasia. And what we decided was, and what we discovered was that there are a lot of barriers out in the community to receiving regular Pap smears, to having regular well woman visits. These barriers were everything from a lack of physicians who were providing Pap smears in the communities, a number of cultural barriers, things having to do with modesty among women of the Haitian community. And we sat down with them and we tried to address all of these issues. And so what we did was we worked with the community healthcare workers and we used a self-sampling device. These women went out into communities, knocked on doors, taught women about cervical cancer, asked them if this was a concern of theirs, and in the comfort of their home, these women were allowed to self-test for high strain risks of HPV. We then looked at these samples. If they tested positive for high-risk strains of HPV, we directed them to the necessary resources. In a way, we circumvented a lot of these barriers that I mentioned earlier. What was great about this project that I jumped on was that my research mentor actually allowed me to take some of my own interests and study them while we were in the field. While we were in Haiti doing field work, I noticed a number of women in rural communities had access to cell phones. And to better understand this, I started talking with them. You know, an idea in my head as, you know, someone who grew up in the United States was that no one would have cell phones down there. And it turned out they actually did. And so what we did was we talked to them and we tried to better understand if they would want to use these cell phones as a modality for delivering healthcare messages. So that was a really neat opportunity for me to take some of my interests and actually tack them onto another large-scale project. I think one of the best things about Miami is that it's not only multicultural, it's multilingual, it's very diverse. It's pretty much what I believe the United States is going to look like down the line. And so if you want to practice medicine, if you want to be an epidemiologist, if you really want to be at that nexus of clinical medicine and public health, this is a wonderful place to be. I think more than anything, as a future physician, my master's in public health has helped me realize the importance of preventative care, the importance of early detection in disease. And you see a lot of individuals come in with late-stage disease. And it's unfortunate because with regular screening, a lot of these diseases could be identified earlier and prevented. I think the wonderful thing about pursuing a master's in public health is that it draws people from various fields of study. You have people coming from the medical field. You have people coming from backgrounds in business. You have people coming from backgrounds in comparative politics, in international studies, and it puts you all in a classroom together. There's a wonderful mixing of ideas, and you're learning from all these fields. You're taking from all these fields, and you see how they apply to your own. There's also a very diverse population, a lot of international students, which gives you a wonderful perspective on how healthcare functions in other countries around the world. There's a lot we can learn from other countries as far as how we provide healthcare goes. And I think it's important to kind of sit in a room and share these ideas with one another and take what you can.